Social drivers of health are the non-medical factors that can actually impact an individual's health outcomes. So joining us to discuss from United Healthcare is Chief Medical Officer for Community and State and the Senior Vice President of Population Health and Social Care, Dr. Alex Biyu. Thank you so much for being here, Dr. Biyu.
Thanks for having me.
So what are social drivers of health and why are they such an important part of our overall health?
So social drivers of health is just a technical term for those things that we rely on every day, like adequate housing, healthy food, transportation, but also things like education and employment. Those things have a big impact on our health every day, which may not be that surprising, but what does surprise some people is those factors actually have a much bigger impact on your health than access to your doctor or health systems.
How do these factors impact different demographics in different ways?
Well, certainly during the COVID-19 pandemic, we saw that almost anybody can be vulnerable, especially if there's an upset in your economic status that will lead to you needing to rely on some social supports. But in particular, we find there are certain groups that seem particularly vulnerable. And today I want to talk about older Americans who have needs around food or housing and just might be reluctant to share that information with us. So at United Healthcare, we screened over 4.7 million of our Medicare Advantage members last year and found that about 1 in 4 had an unmet need and wanted help.
And what are some effective ways to help older adults access the food, the housing, and additional resources that they need?
Well, for us, it starts with our benefits. First, connecting people to help with food or perhaps with transportation, as well as helping navigate people around housing. But we also really work hard to connect members back to resources in their own communities, which can also help address social isolation.
And where can we go for more information?
Sure. Well, you can go to unitedhealthgroup.com/research. And there you'll find a full report on what we've learned through our members' eyes, as well as be able to look at profiles for individual states.
Dr. Biyu, thank you for being with us today. We appreciate it.
Thank you.